Hello, this is Dr. Lewerenz at Longevity Health Institute. Immunity building part 2. And very important in this pandemic we're in with COVID-19 and the coronavirus and all these influenzas and viruses popping up. And truthfully, all of the patients that we've tested throughout the last several months, the majority are negative, just so you know. Majority of patients that have upper respiratory viral fever, etc. There's other viral infections and other issues that are going on, including allergies right now, that you need a strong immunity. But I'm going to tell you a big way to build your immune system. You've heard me say this already before, but I'm going to tell you exactly how, and very simplistically, is how to build your immune system. And then I'm going to tell you about some low-lying fruit. And that is tongue-in-cheek, but low-lying fruit that can really help you in potentially preventing COVID-19. Now that's a strong statement, but there's a multitude of studies, there's a multitude of information, you've probably already heard it out there, and that's the benefits of vitamin D. Vitamin D, many studies, there was a 5-nation study not long ago, including Italy, was in that study about actually people had shorter hospital stays and actually had less mortality when they had more optimal vitamin D. So get your vitamin D tested by your practitioner, be on appropriate dosing and followed by a doctor with good medical guidance and coherence with what's going on with you personally, okay, but an optimal quality vitamin D, okay, 60 to 80 is their typical optimal range, and yes, things matter like your vitamin K level and magnesium and in other things like gut health. In fact, I hear this over and over for years and years. Patients that do not have a good gut, okay, the first thing you got to think about, you don't have a good gut, you're not going to absorb vitamin D well. And I have patients come in here all the time as new patients, and they're like, hey, no matter what I take with vitamin D, it won't absorb. I don't get good levels. They put me on these doses. Now, one could be they're not on enough, but two, you have to think about what's going on with them digestively and are they absorbing. So, you can overshoot the dose to get better numbers, but also you got to think of, okay, well, what's going on at the immune system at the gut level, okay? And that's a little hint about what immunity building part 2 is. So immunity building, the most important thing for your immune system, and you've heard me say this in part 1, but in things related to personalizing your care and building up and optimizing immune system, is vitamin D, vitamin C, zinc, quercetin, curcumin, ECGC, green tea, NAC, which builds pools of glutathione, which is a huge antioxidant, good sleep, melatonin, vitamin D. I think I already said that, but these are all very important, and you can watch my previous video regarding that, okay? But what's really where the rubber hits the road and where you can get real good traction on building and progressively building your immune system month by month, year by year, decade by decade, and maintaining that is not only for immunity, like preventing a virus and preventing, an outbreak and preventing allergies, but anything that affects your immune system, including things like, cancer, inflammation, autoimmunity, colds and coughs, viruses. You need good gut health. That's right, good gut health. So you've heard of leaky gut, you've heard me preach and talk about leaky gut, and your gut, your digestive lining, I call it, is like your border wall, okay? It's your border wall. It's where you break down foods, this one-cell epithelial lining. It's where you break foods down and you assimilate them and bring them into your tissue and into the body, okay? And if that gut barrier, esophageal, bowel, small bowel, stomach, etc., if this is compromised and you have something like leaky gut, or you have something that you're not absorbing well and you have intestinal permeability or SIBO, or these are overgrowth in your small bowel, and you're dealing with IBS, constipation, diarrhea, belching, burping, bloating, etc., more than likely you have leaky gut. And you need not just to treat the yeast, the candida, you not just need to fix what's going on there, you need to reestablish and build your digestive barrier. And I'm going to tell you quickly how and how simply. Now, I want to share with you, and I'll do this at the end of the video, is that where you can get professional grade, certified GMP, USP, high standard medical pharmaceutical grade supplements. And these are going to be third-party tested, so you're going to get the best effects because you're getting high quality products, just like a medication would have those standards, okay? So third-party testing, these companies, they deal with doctors and physicians and professionals only, and you actually are going to get better quality, so you get better results, okay? Like anywhere, right? Better quality, better results. And that's what you need when you're talking about immunity. It's not something you want to buy an insurance policy on that'll never pay you. Tell my patients that all the time. What's insurance worth if you end up with a high premium, but there's no ever payoff? You need to get a good payoff with your gut health, okay? So how do we do this? Well, one is eating foods that are the least inflammatory, which notoriously, in a non-personalized way, I will tell you, because here we test you and we look at your blood on a microscope and we do food and allergy sensitivity testing and we look at your gut flora and we do stool analysis and all that, but we first screen you by a live blood analysis. And when we do that screening, okay, we can really tell you right on the moment, at point, do you have leaky gut? And how do we fix that, okay? So the best diet, though, is the least inflammatory diet, which is going to be gluten-free and dairy-free. Now, if you're sensitive to other things, it's probably because you have leaky gut and that needs to be fixed. So of course, avoid those. If you react to nightshades or corn or egg or what have you, yes, you should probably avoid those. But simply avoiding or limiting gluten, taking dairy out, and eating a low-carb, non-processed, whole food diet, you're going to do much better, okay? Now, just like putting any wound together, which essentially is what intestinal permeability is or leaky gut is, how do you heal a wound? Well, you're going to heal a wound by simply this. It's really simple. Is if you have an infection or you have some overgrowth of bacteria or imbalance there, how do we treat that? Well, we have ways in a personalized way that I'm not going to cover here, how to treat candida and yeast. But you can always take a high quality, again, third-party tested, I recommend, high quality, medical grade supplement of probiotic. You take a probiotic and good probiotic flora, these billions of colonies can then kill off yeast and build up your immune response, okay? And then you digest better and you absorb better, etc., okay? The other thing is you can use an amino acid, okay, called glutamine. Glutamine is an amino acid that's regenerative to tissue, including the epithelial lining of your stomach, okay? Very, very good and very, very effective, okay, in healing the barrier. These are 3 simple steps, just like any wound. Don't irritate, put it together, treat it like it's an infection, okay? And yes, you can use other things. You've heard people talk about collagen and aloe juice and immunoglobulin protein that we use a lot, and a candida diet. And there's many other things that I could throw at you and tell you here, but that's not personalized. But 99.9% of people to heal leaky gut need these 3 steps, okay? Glutamine, probiotic, and being gluten and dairy free, and they will heal their gut, okay? Or they'll at least get going forward in the process of building their gut health. And then what are they getting? Then they're getting true immunity. And now you're able to fight off viruses, bacteria, allergens, autoimmunity, cancer, etc. much better, okay? And that's the goal, right? To have a higher immunity and be able to fend off things that come our way. And as we build this antigen antibody response, we then actually create a healthier inside and out, and we can deal with this world in 2020. So hopefully that's educating and enlightening. And again, if you haven't, watch Building Your Immunity Part 1 that I did roughly a month and a half ago. And any of these supplements I mentioned that you need, we do have a warehouse that drop ships, and that's through our website, longevityhealthinstitute.com. That's INC.com. And it's connected through Carewell, and Carewell is our fulfillment company. You can go on there, shop on the supplement shop. It's down on the bottom right, and the password to order is health. And you can order glutamine, probiotics, and all high quality third-party tested supplements through there. And of course, myself and my practitioners are always here to take appointments, telemedicine and in-person visits, done distancing hygienically, CDC guidelines, mask, glove, etc. And you will be protected, and then you'll further be protected by building a gut immune response for the rest of your life, okay? But you can change your immunity months by decades, by years, by decades, by building your gut lining and fixing leaky gut. This is Dr. Lewerenz, Longevity Health Institute. Be well.